Good evening, everybody, and welcome to today's episode of Marvelous Medicine, which is about artificial intelligence in medical education. The speaker is Dr. Avinash Supe. He's the Emeritus Professor GI Surgery at GS Medical College and KEM Hospital, Mumbai, where he also did his MBBS and MS General Surgery. He has done several fellowships in surgery and has done masters in medical education and medical administration. Currently, he is also the Director of Clinical Governance at PD Hinduja National Hospital and Medical Research Center. Dr. Avinash Supe is extremely passionate about medical education and public health and is an advocate for medical humanities and empathy in practice. Dr. Avinash has around 200 publications and has authored books both in English and Marathi. He has played a pivotal role in revising the MBBS curriculum, which is followed currently. In recognition of his exceptional contributions as a medical teacher, he received the Dr. B.C. Roy National Award. Ms. Aruna Shanbag received unwavering care at KEM Hospital for over 4 decades when he was the dean. Dr. Avinash Supe, who's a role model to those striving to combine technical skills with compassionate care, we are very, very honored and thankful for you for having accepted to join us today, sir.
Sure. Thank you so much, Vidya. I think I'll just try to share my slides.
Moderating the session will be Dr. Puneet Dhar, who's the professor and head of department of GI surgery at Amrita Hospital, Faridabad. Dr. Puneet Dhar did his MBBS from Maulana Azad Medical College, MS General Surgery from Safdarjung Hospital, and MCH Surgical Gastroenterology from GB Pant Hospital, Delhi. He also has done a fellowship in transplant surgery in the United Kingdom. Dr. Puneet Dhar established the Department of GI Surgery at All India Institute of Medical Sciences, Rishikesh, as professor and head, and was also the Dean of Student Welfare, where he put in a lot of effort to engage students. The president-elect of the Indian chapter of the International Hepato-Pancreatico-Biliary Association. He's actively involved in medical education and research and is passionate about spreading awareness and knowledge about medical humanities. His non-medical activities are too many to enumerate, so you could follow him on social media to know more about his other passions. The other moderator at the request of Dr. Avinash Supe will be Dr. Bhatta Radhakrishna, who does not need any introduction to followers of learning general surgery. However, if there are any newcomers on Marvelous Medicine today, he is the director and senior consultant in the Department of Surgical Gastroenterology and Minimal Access Surgery at MGM Mallan, Chennai. Dr. Radhakrishna did his MBBS from JIPMER Pondicherry, MS General Surgery from Stanley Medical College, and MCA GI Surgery from Madras Medical College. As many of you probably know, he is the chief administrator of the Facebook group Learning General Surgery, which now has 45,000 members from across the globe. His daily write-ups are eagerly awaited, and he holds up a mirror at what is going on in our profession in a humorous way. He's an active member of the Association of Surgeons of India, Indian Association of Surgical Gastroenterology, and the International Association of Hepato-Pancreatico-Biliary Surgery, and other professional bodies, and is a much sought after speaker at national and international conferences. His quiz sessions are the highlight of many meetings. The voracious reader collects books, turtles, and bottles, and loves to host guests and conferences in style. Over to you, Dr. Avinash Supe.
Sure. Are you able to see my slides?
Yes, sir.
Fine, sure. Thank you. Thank you so much, Vidya. It's a really honor for me to be here, especially when my two great teachers, Dr. Sethuraman and Dr. Nandi, are here. And I would like to also thank Dr. Patta and Dr. Puneet to be part of this whole session. And I think let's explore. Now, I'm sure artificial intelligence has already entered our life. Whether we do a Digiyatra where there is a face recognition, or whether you do formal verification, there are movies in which artificial intelligence has been there. It has already entered in our life. So we are part of artificial intelligence in Google Maps. Now we are proud of Indian forces. They did Operation Sindoor yesterday, and we are all talking about Operation Sindoor, but they used AI there. And what did they use AI? They did AI visualization, predictive analysis, advanced weaponry, precision strike weapon systems, and autonomous weapons. All this was used in yesterday, and we are all talking about how we use AI in this particular kind of an attack. Now, if you just type the word artificial intelligence in PubMed, we get 295,000 results. This is all mainly in the last 8 years. And that's where I think you have to really understand why people are really talking about artificial intelligence in such a big way, even in a PubMed. Now, for those who have no idea about AI, I will go with very basic that AI has basically two types of AI. One is discriminative AI and second is a generative AI. So discriminative AI has been there for many years. It started in 1950s, initially started as AI, then it started as machine learning, and then it started as a deep learning. And today we are in an era of a deep learning, while generative AI has been a recent last 2 or 3 years when we have started talking about content generation with the help of AI. So when we talk about discriminative AI, it is basically machine learning. For example, there's a large amount of analysis they do, either image analysis or data analysis, for diagnosing pneumonia from a chest X-ray image, predicting sepsis score in ICU patients, estimating stroke recovery, and predicting patient admission rates. Now, this is all discriminative AI. Now, why this has really needed? Because data doubling time has become 73 days and it is reducing every day. So we are thrown with immense amount of data and we are not able to process it. So all that needs to be done with the AI. So I understand the real what is I'm looking at. We are not able to cope up with the data kind of coming to us. Now, discriminative AI is a training in pipeline that you continue to train people and then it will give you better and better results. So it is used in X-rays, medical records, and that is the kind of a thing it is being used. On the other hand, when you talk about generative AI, that creates new content, text, images, speech, even structured data. And what they have done, they probably use the deep learning models. They go to various kinds of internet and they create various kinds of text generation, like clinical documentation, editorial, as Nandi sir said, articles, AI generated radiology reports. So these are called as large language models. So they are pre-trained on a huge databases, fine tuning and reinforcement learning with a human feedback. More and more we use, it becomes better and better. Now, I'm not going to talk about much about the clinical kind of impact, which I have spoken on many kind of platforms, but today I'm going to concentrate on what is its impact on medical education today. So if you really see what has happened, there has been an evolving relationship between artificial intelligence and medical education. Initially, it started with the higher education and school education, but now over last 20 years, it has come now into the medical education. It is coming slowly. There are current applications of medical training and assessment. Assessment, it is picking up. There are benefits and opportunities. However, there are challenges and concerns. Everybody has ethical concerns, plagiarism, copying, and everything is there. So we need to find a balance and we need to think about integration strategies in this kind of an education field. And we need to look how are we going to cope up with AI in medical education. Now, what is the current landscape? Artificial intelligence systems are increasingly appearing in clinical and educational settings. Day by day, we find in last 2 years, we are seeing it coming up. Many people are using it from everything, from stool screening to lab reports and generating reports to diagnosing something. We are being using it all over. Medical schools across the world are adopting curricula to include AI literacy. Now, I feel this is something which we should all remember. AI literacy is, I think, important. And for last 2 years, I have been trying to have a mission of AI literacy across, not only in India, but across in the neighboring countries. So I think all medical schools should have AI literacy. Then growth of AI powered learning tools and simulators. This is becoming more and more common. People are using more learning tools. Then we find our medical students are becoming AI natives. I think this is something which our students today, I was talking to a young student and I was using iPhone and I asked him, what are you using? So he says, I don't use Safari, I use Brave because there are no ads and it is helped by Meta and Perplexity. So they have a very different way of looking at the whole concept. So they are AI natives, I call it. So we have more and more students, we are becoming AI native. And there are blurring lines between educational tools and clinical decision support. This is where I feel we should really look at it. So let's look at some areas where AI has made a big impact. I'm sure we will not be able to go through all areas, but we'll try to look at some areas. One of the area where AI has made a tremendous influence is AI in simulation. Artificial intelligence in simulation involves using AI techniques to create a realistic data-driven simulations that mimic real-world environments, their behaviors as well as complex systems. And this is where a modern approach of artificial intelligence came. So there are various kinds of AI simulations. There are mainly the four types of AI simulation: predictive simulation, interactive simulation, behavioral simulation, and immersive simulation. Now let's go little deeper and try to understand what is this actually. Now first is predictive simulation. The use of AI to forecast possible outcome based on data inputs. Now I'm sure all of us look at the weather channel. We look at the weather forecasting. Today rain is occurring, not occurring, financial modeling, disease space predictions. Now all the time, many times used to really make fun of the weather forecasting. But today, with all these models, it is becoming better and better, and we are closer to what really happens. To give you, this is one article from Journal of Safety Science and Resilience from 2024 May. That is AI for science predicting infectious diseases. This is something you can predict infectious diseases. So about 7-8 years ago, I got an idea that why not we use AI for predicting this. So what I did when I was a director of municipal corporation and medical education in KEM, I collected 50 years of data from the meteorological department of Mumbai, and I put it into the AI data analysis. And I also got the data of the disease patterns which were there, like how many patients of dengue you get. And I tried to analyze and found out what kind of a disease prediction you have, dengue outbreaks based on the rain, because rain can be different. Sometimes it can be heavily rain, can be lightly rain, there could be gap. So based on these kind of patterns, now you can have the dengue outbreaks, you can predict it. And this has helped many of the health systems now to prepare for a better kind of an preparation for dengue. So you don't have to then close OTs or anything like this. You can use it much better when you know that this has happened. And this is a PhD thesis. One of the students did it, which is published in last year. So it was a wonderful kind of a work you can do with AI. The second type of simulation is interactive simulation. This allows real-time interaction between users and the simulated environment. So you can simulate anything nowadays with reasonably well. So pilots, I'm sure everybody knows. There was a beautiful movie, Sully, which it showed, surgeons, and of course, so to give idea, this is a Harvey cardiopulmonary resuscitation. Many of the universities today have this, and they teach us these kind of students interaction, where students talk to and they get responses when you do all this.
The group is going to be understanding the same reality. So now the instructor can really focus on how to manage a complication. Nothing ever has provided that level of information. It's not a textbook, it's not a video, it's not a PowerPoint presentation that's going to give you that kind of understanding. CA Healthcare selected shoulder dystocia as the first scenario on Lucina AR because it's a rare complication of delivery, but it's one that's difficult to manage. You have a number of options. You need to think fast. Seeing the anatomy, seeing the progression of the baby in the birthing canal, and seeing where the shoulder gets stuck is going to be very helpful to understand how to fix it. Seeing them in front of your very eyes as a student is like a revelation, right? This is the future of healthcare education. Really beyond the spectacular of that experience, there's an educational purpose that we're fulfilling. And that
now, if you really see here, we can add any kind of a situation. We can really do shoulder dystocia, bridge, and we can really ask students to learn, then debrief it. Now, see, 20, 30 years, you would say I have 150 deliveries happening in my hospital. But today, I think people are more ethically concerned, and therefore, nobody can learn on, the students cannot learn in a labor ward today. So they have to be learned here, develop their competence to some level, and then they go into practice into the patients. The third component of simulation is behavioral simulation. Their focus is on simulating human and animal behavior. So initially it was thought that mental health is something which is usually not the involved in all this. But today you have, look at this Lancet paper, they are creating the digital mind, AI informed mental care, and they are now creating new concepts in the mental health from promise to practice toward the realization of AI human informed mental health care. The last one is immersive simulation. It combines virtual reality and augmented reality with AI for highly immersive training. Now, this was done for military drills, but look at this immersive lab. Now, here you can really hold a heart, you can reflect it, you can really see exactly, you can hold the lever, you can make it a size of the whole room, and you can learn it. And this is from India. This is an immersive lab at GSL Rajmandri, and this is from our own colleges. So our colleges are also upgrading themselves for these kind of immersive labs. Now, what are the various methods of AI simulation? Usually they could be data driven, agent based, or digital twin simulations, what they call. Data-driven simulations are very easy. This was a paper from Surgery 2020, an international journal, Surgery. So there's a traditional prediction of, say, a particular accuracy it gives. And if you use artificial intelligence, then even simple things when you're trying to make a diagnosis, it will give a better accuracy of 94% compared to otherwise whether you got 82 or 84%. Another example is a classical crowded casualty. AI assisted acute patient journey mapping. Now, most of the time, a hospital like KEM has 800 patients coming in casualty every day. Out of that, 200 need ICU and 50, 70 need a ventilator. Now, to follow which patients are really having a proper pathway and utilize those services well, these are called as clinical AI assisted softwares. And these are becoming very popular across the world, and they are coming up in India as well. Hybrid simulation is when you are combining the real environment with the virtual environment, and you create a mixed reality like augmented reality and augmented virtuality. For example, if I want to operate, say, a myomectomy, I can create a tumor like this. So this gives me a better information about my tumor. I can do it for liver, I can do it for pancreas, and I can know exactly whether it is studying or not. So look at this kind of a liver. I can hold it like this and I can teach. Now, students will learn much better. And once you have this with HoloLens, you are seeing this. I can hold the lever, I can rotate it, and I can see this so that my understanding of the anatomy is so better. And in fact, I can use this for intraoperative assistance. And you can really make a lever like this size of the whole room and hold it, and you can really make it such a big kind of a lever, so you are not likely to miss a small duct or a small kind of an portal radical or hepatic vein. Exactly, you can come to know. In fact, today there are some hospitals who would do intraoperative image guidance. That means here you have seen they have virtually cut the hepatectomy they have done. Now he will keep this kind of a holo vision, what they call it, next to him while he's operating. Now this is something which is of a great help. This will help him to operate and go along with his holo vision. The second thing which is coming up in this AI simulation is called as a digital twin simulation. It creates a digital replica of a physical asset like a machine or human to test the performance in various scenarios. For example, this is called as the DNA nudge technology. For example, you create a digital twin of the patient, and you normally try to look at what are the various treatments you can try with them. For example, this was a paper which was presented in an AMS conference, and this is from Mumbai. In Mumbai hospital, they created these kind of digital twins to control uncontrolled diabetes of patients. So you create a digital twin, then you start comparing which diet will suit him. He's a vegetarian, non-vegetarian, what kind of medicines is suiting to him, what is his lifestyle, and then you try to see how it really matches with the help of your data. So this becomes a very interesting method to see how we can control these patients. Now, AI generated patients is a new world. Now you will find there are different kinds of AI generated patients. Now, these are called as virtual patients. Now, scripted virtual patients. When I did my first course with Sethuraman sir, they taught me PMP. They called as they used to have case scenarios on which they called as the pre-programmed decision trees. And then came artificial intelligence driven interactive patients. And now we have what is called as an avatar based virtual reality simulations. And what are those? Let's go and understand. Now, these are classical, what you call as an scripted patients. You have a history, present illness, and you try to look at them, and then these patients talk to you, or you will get an answers on and site. There are programs, they are called as virtual patient, is a chest pain number one, and they'll interact using the chat interface. And when you ask them a question, they will answer. Now, this is currently going on in, say, San Francisco or Florida, but I'm sure in India we have to Indianize it, and this will be coming to our place immediately. Now, avatar virtual patients are something which is a new thing. Even if you go to PubMed and type avatar virtual patients, you will have almost 272 papers, and they create these patients. There are sites where you can create these patients with scenarios like stopping antidepressants, suspected bowel cancers, osteoarthritis concession. This is where students can learn about communication, and it gives you feedback. Most important, it gives you a personalized feedback. So type 2 diabetes, remote consultations, you all can really use this, and then they will give you answers. And with this interaction, students learn much more and they understand what are their gaps. So AI driven rehab hybrid models are now also existing, where you can talk about people how to rehab them. Now, another thing where AI has made a major impact in addition to the simulation and generated patients is creating educational resources with AI. This has become, something which is so easy to make an AI. Now, tomorrow, I remember once I went to one college and they were complaining that we are not able to make proper MCQs, papers, and all. Now, AI can do it for so easily for you. Generative create content like audio, video, images, text, and video. This all can be made very easily with the help of AI. And artificial intelligence automatically using a computer program. Now, somewhere about 2023, Chat GPT came, and that was something which was a big thing. I think everybody got it was 3.5, and that time it was free. Then they were trying to bring 4, which was paid version. And then there's a series of various kind of those chatbots came. The Microsoft got Copilot, Google got Gemini, and people started using it. And somewhere last year, a DeepSeek came, and so now what has happened? Like we used to have many channels, like you have a Sony channel, Z and Z Cinema and everything. So all of us previously, when it started in 2000, used to subscribe for it individually. So it became very costly for us. So then came the Tata Play or Airtel. So they started giving us a bunch of the channels, 200 channels, 300 channels, or a short space. So same thing is happening now, what I called as an aggregator apps. So now we have a Perplexity, Nova, all these apps are coming, which would give you many of these apps together at a very low cost. Now, low means if you take a Nova, it costs about 4,000 rupees per year. But if you take Perplexity student version, many of our students, it costs only 1,200 rupees per year. So it is 100 rupees a day, which is not very costly. So many times I've seen people have started using this. Then creating PowerPoints with AI. I think this is also becoming very popular, though it is not so good. Sometimes I'm not very happy making PowerPoints. And I must tell you, this presentation is not made with AI. This is made personally. So there are many sites where you can make PowerPoints, like say Gamma, Slide Go, Slide PPT. There's one more site called AI PPT, which are not very costly, 300-400 rupees per year or 500 rupees per year. But especially AI PPT, Gamma is a little costly. And the last one I told you is a Canva. Canva is a visual work suite. Previously used to have a Photoshop, something like that. You are now Canva. Now, Canva does what? You can create any image with this, and there's a Canva Pro. Again, these are, if you go through the students' versions, they are not very costly, or teachers' version are not very costly. So, applications, if you really look, where do people use? And this is called as an edu cause. It is dreaming, it helps you to dream. That means help you to think. If you want to brainstorm, you want to create ideas, you want to getting discussion points, summarizing or synthesizing complex content, research and analysis, asking questions, learning. I think this is something which is becoming so easy, to think about it. Then it is lightening your load. If I have, say, 200 page, I have to read PDF, I can, if I want to do it very quickly, I have to just put it in one of the app and it will give me summary. Now, there was a study which said that 22% of the peer reviews are today done with the help of AI. Then building your content. If I want to create some content, presentations, slides, creating courses materials, exams, especially MCQs. I want to create syllabi. Then I want to create lecture notes, editing and creating images and videos. It is becoming so easy, especially I have done an operation. For example, I've done a very complex fundoplication or something like that, and I want to showcase and I want to present in, say, 8 minutes or 6 minutes in a conference. Now, doing this has become so easy with the help of these applications. Look, some of the common things we used to do have become very easy. Then developing, advancing your work. If you want to take it, institutional policies, you want to draft it, or you want to do, say, create some detailed project plans, you want to use data analysis, something like I have a large amount of data which is in Excel and I have to just analyze it. So there are apps like Data Spiral, Julius. They would do it within a minute. You will get all the piegrams and charts along with a plot. And I have checked it many times and it works very well. Most of the time it is true. So you have to just be sure, verify and trust, what I call it. So when you start about education uses, it can help you with planning, generating ideas, outlining. It will help you. I want to outline a lecture on something like this. I want to take a lecture or I want to take a session. I want to take a conference talk or I want to do anything. It will give me a proper outlining. Then I can build on this. You can write down objectives very well about my class. If I want to take a class, I would say, these are what are my specific objectives which I want to do today. It can create summaries for students. I can, after my class, I can give a summary to the students so that makes it so easy. So the students also learn what are the most important take home messages. I can create lesson plans for me, that I want to have exam, I want to have a MCQ kind of, I want to put it, I want to play a game. All this can work out well. It can help me discussion points. It will tell me what are the most difficult areas which you think, and then you continue to verify with them. Questions. You can say, these are the questions, tell me the questions we should ask for the class. They will give you those key questions. It create contents, quizzes. I'm sure Patta does wonderful quiz, and those who have not attended Patta's quiz, it's an, I think, experience to really go through these quizzes. He works so hard. He has so much of work on history and he does it. So I personally feel rubrics, then gamification, checklist, feedback prompts, assignments, examples, scenarios and theories, all this can be daily done by this. So I think this is something which you should really do. And just a minute. And when you are doing a paper writing, you can really do proofreading, updating, and something like translations you want to do, captions, mnemonics, citations, analogies. All this can be done so easily with this. Now, to give an example, most important thing in any creation, gendered creation, is what is called as a prompt writing. And prompt engineering or prompt writing is a science by itself. That means if I learn this prompt writing, there are different formulas. So one of the formula is called as an RTF formula. So what it tells you? It tells you what is my role, what task I'm going to do, format, and some people add source to it, S to this, So role, task,
The
format.
sound is getting there. What about
So
what about
Hello. Okay. So you are a biochemistry professor teaching medical students. Then create a 10-minute mini lecture on Krebs cycle with emphasis on how pathology involving cycle can clinically present, and show it in a presentation limited to 8 slides. So some of this can be really done in that particular way, which, and then you say, also give me sources for each of these distractors or an MCQ, and it will give you all that in a nice way. Now, what my experience is that if you have taken a free version, then sometimes I'm not sure about those resources because they are not updated. But if you take a paid version, then most of the time you'll find 99% of time those resources are correct. So what are the benefits of using AI for research? This is one area where you can also use in medical education as well as for students' thesis and all. It will help you idea generation. If you struggle to spark new research ideas, then AI can help you. If you say that I want what is the current areas of research for, say, you can give them a topic, whatever topic you want to give, they will give you what is the current ideas. I say use of ICG in, say, bowel anastomosis. Can you give me the recent ideas? So they'll give you recent papers and will tell you this is one area where there is still not a good answer. It can brainstorm fresh research questions, hypotheses, even suggest innovative experiment designs to propel your research forward. Then another very important thing AI can help you is called as a smarter literature reviews. Now see, no more wading through the mountains of papers. Now what used to happen when I was a student and when I did my PG, I had to go to library with large bound volumes. And that time there used to be a Medline and I had to search each of those volumes. And then I had to really find out my experience. And then many times I used to make mistakes and I never used to know which is the best literature review. Then came Google and internet. So we started typing one kind of a topic, and I get sometimes 500 papers, 300 papers, all this. Now, how do I know which one is good or which one is bad? So this is one kind of, there are now apps have come like Research Rabbit, where you can really put it, it will give you a complete network that, okay, Dr. Nandi has worked on, say, uh, portal shunts, and this is the work done by him, this is work done, and then they will link it all together and they'll tell you who are the people who have done best work in that particular field, and they will also give you the latest kind of articles and summaries, which are the review articles, which are systematic reviews, which is meta-analysis. So it reduces your work by a smarter literature review. And this is of a great help today. Writing assistant editor, you can improve your writing and streamlining your workflow with AI's editing prowess. Get real grammar and punctuation marks. Now, to be very frank, this is something which is little worrying because sometimes they would use a word which is not in your style and you have to really see, but over a period of time, if they understand your language and you interact with these AI apps many times, they will try to give you in your style. You can write there, give it me a professional style, give me in style of Avinash Supe, so they know what is my style of writing, so they would give you in my style. So this all can be learned over a period of time. It will also give you about citation management. Many times we have references which are not proper. We have to go and search them. So what I have to do, I have to just put a rough reference which I know, and I tell them that put it me like a Vancouver style, and they will give me a proper reference within a minute. And this helps me exactly what to do about this. Now the question is, will editors accept this? Now there are many journals who have started changing their policies. They accept some aspects of this. For example, if somebody has used AI for citation management, somebody has used for writing assistant, then you have to disclose it that I have used this kind of an app for this particular kind of an work. And many journals have started accepting that. In fact, if you use AI, it can be integrated into each step of research. Data analysis and interpretation, discussion and future research, write a conclusion, you can write it very well, citation and references, editing and proofreading. And most important, you can ask which journal I should send because they will try to do your study, they will look at it and they'll find out. Every time it is not true, but they'll give an idea that your is a case report. This journal does not accept case reports. This is something which is a review or something like that. In fact, people have also asked which conference they should really use it. So this is something they will probably do it. So AI assessment and learning analytics, where this is another aspect which is coming up in a big way. So what is important is that we are now trying to learn about a student by observing. But here they do analyze your data and then do change management. And that works better, if you do with learning analytics. So I'll give you an example, of course, surgical example. Now, this was a paper from, I think, surgical endoscopy or something like that. So deep learning, they use this convolutional network. So they took the videos, unlabeled videos of residents who are unlabeled lab videos, and they try to analyze it, and they give rise to anatomy detection, instrument detection, action recognition, phase recognition, and how much time it takes. So to give you an idea, instrument detection, it will analyze and give you a chart. How many times he has used bipolar, how many times he has used a grasper, how many times he has a hook, and what is the direction in which he has used, how his hand is stable or not stable. And this is of a great help for me to understand my resident. Then and it will also suggest me what kind of an exercises I should give to my resident. If his left hand is weak, I should give him left hand exercise. If his right hand is weak, I can give him the right hand exercises. So you can personally look at the pathway of learning for that student. And that's the great advantage of AI. LMS is something which has also come, that is education management. So this was a recent kind of a paper from 2024, which said that AI-based learning management systems. So most of the colleges and schools are now accepting this. Medical, it is not yet come, but I'm sure it will come. So what are the benefits of these? It will enhance engagement. Students tend to engagement. I'm sure Balaji did this work of portfolio, electronic portfolios, and it was of a great help to them. Then personalized learning paths, it helped them for personalized learning paths. That means they will come to know exactly what is the pathway which is likely to be there. Then automated administrative tasks, it will tell you basically that if there's 100 students do simulation, it will analyze and it will tell me who are on the top 10, who are low top 10, who are doing regular. So those who are not doing regularly, there only we need to concentrate. Predictive analysis, you can really find out who is doing well, who is not doing well. And improved learning outcomes, basically content generation and assembly. This is something which is very important. So key features of AI powered LMS is adaptive assessment and feedback, predictive analytics, text to audio, and gamification. Now, gamification has come in a big way in education. And with the help of AI, you will find more and more people are using things like Kahoot, Mentimeter, and these are getting the new generation of students enjoy all this and they get more engaged. So, if you look at AI as a partner, it has benefits and opportunities like personalized learning paths, simulation of rare cases without patient risk. We can really show everything to them, accessible 24/7. Now, this is what many of the students have said, that they have now newer generation wants 24/7 access. Objective assessment of clinical skills and knowledge. You are looking at them more objectively rather than just subjectively that he is good or bad. And reduce administrative burden to the teachers, which is their always complaint. A virtual patients with a dynamic responses, AI-powered anatomy visualizing tools. I'm sure all of you have seen Anatomage, natural language processing for clinical reasoning assessment, and of course, question banks and scenarios and procedure skills. But AI has also many threats and challenges and concerns. We are worried about dependency risk. Are we diminishing critical thinking abilities of our students as well as teachers? I think everybody is doing it so quickly without thinking. So sometimes there is an automation comes into their life and it reduces the critical thinking. Skills get atrophied, reduce hands-on diagnostic experience. I would like now today also you find many students first see ultrasound and CT and then they see the patient. And previous age old we used to see clinically and then see the diagnostic. The practice doesn't help today. Many people just want to see diagnostic experience and do it. There's something called as a black box phenomena. lack of transparency how AI reasoning occurs. There are a lot of biases and lot of wrong answers which are also given by AI. Ethical considerations. We have to worry about privacy. Anything you put in AI is absorbed into the whole data world. It can be used by somebody else. So I would tell you, don't put your thesis or any new idea project into AI because it can be copied and anybody would take that idea. There could be biases. Accountability is a big issue. And we really don't know about that. People are cheating. But I must tell you, cheating is a social problem. Human connection, potential loss of empathy development. And this is another concern. I think Vidya talked about it in the beginning, that we are all worried about, are we losing the empathy with our patients? And educational equity, technology assess disparities. This is something which is happening today. So many students don't have access to this. So I personally feel leading to inaccurate and unethical outcomes and computational cost. And this is something which we have to worry, and interpretability of AI decisions as a black box model. So if you look at AI gap in skill development, in a traditional medical education, there was a structured clinical reasoning, progressive skill development, deliberate practice, and mentor guided learning. And this was a very classical way we used to learn. Now, AI supplemented education is a pattern recognition, and that's where the AI works. It finds out patterns, accelerated knowledge access, we get it quickly, we have a simulated experience, and we have algorithm guided learning. And this is becoming more popular all over the world. So, what are the potential risks? We are over dependent. There are skill depth and gaps. We may not learn deeply as we used to learn by our own experience. Clinical intuition atrophy, I call it. Basically, I feel we have that clinical intuition is getting lost and less human judgment. So, this is something which is happening. So, what are the lessons learned over years? Now, I've been using it for last 3 or 4 years. So, I feel what are the lessons I've learned? AI augments, but it will not replace the humans. AI makes life easy for teachers and students. Trust but verify. Don't trust AI blindly. It makes mistakes, it has biases. Ethics first and technology second. I always feel we should be ethical. It is close what you want to do it. Personalization over standardization. AI is taking us to the personalization, personalized medicine, precision medicine, personalized pathways for learning. Inevitable AI intelligence into publications. This is something which we cannot stop today, and empathy cannot be automated. So, to understand, we have to find the balance. We have to have an integration strategies. AI literacy as a core competency in medical curriculum. All of us should really strive for AI literacy. There should be intentional design of AI plus human educational experiences. Preserving human mentorship along the side of AI tools. Teaching critical evaluation of AI outputs. This is what students should learn now. And ethical frameworks for AI use in education, which have not really come. And we have to have a hybrid assessment models combining AI and human evaluation. So this is where we need to balance. And how we should do it? We need to have an integration framework. Like we can have a foundation phase where a human-centered learning with limited AI tools, then you augment it with AI-assisted learning with human oversight, and then we partner it, and then we students learn to assess when to use or when to override AI. Now, this is something which is called as a critical evaluation. When somebody starts to understand when to override, I think that's the best level you can take him that way. So, what is future outlook? So, AI is becoming a third participant in medical education in addition to teacher and student. Growing needs of AI literate physicians. We have to have physicians who are AI literate. Evolution towards symbiotic relationship. We need to work together rather than work alone. Redefining medical competencies for AI integrated world. So we now need to think those which are tasks are very repetitive can be replaced by AI. So we can concentrate more on critical AI. Maintaining the human element as medicine's core value and transforming from AI as a tool to AI as a teammate. So make AI as a participant and teammate rather than AI as a tool. So I would like to say what are the key takeaways. AI offers an unprecedented opportunities to enhance medical education. Like any other educations, it has really causes unprecedented opportunities. Threats exist but can be mitigated through thoughtful integration. If you go slowly over years, this will get, if you integrate it well, then I'm sure we can reduce these threats. The ultimate goal is physicians who work effectively with AI while preserving the human judgment. And I think how to ensure partnership while minimizing threats. So, what is future of AI in education? We have to understand our students. We are talking to students who are Generation Y and Generation Z. So, they are different. They are not the same kind of students. So, if you consider the differences between millennials and Z students, our Generation Z students have independent learning at their own pace. They explore topics in depth. They are tech rich. They work on digital textbooks. They like videos and gamification. They used to having information delivered to them in a personalized way. One study said 39% of Generation Z prefer learning with direction of a teacher compared to 25%. And the last, which was very important, they spend more time on their smartphones. Look at the children in your own house. They are more likely to use electronics every 7 minutes. And that is what I feel we have to adopt themselves to our teaching methods. To give an example of coffee, I personally feel, when I was a student, I used to take 5 rupees or 3 rupees coffee. Then I started drinking 30 rupees coffee. But today also, I cannot go to various places and spend 500 rupees for a coffee, which my young generation students easily spend. And this I feel is a generation gap. So today is a generation of cold play. They are the people 1,35,000 dancing together with something which is there. Now, this is a different generation than what I generation is there. So they are the generations of Kahoot and Mentimeter. They like these kind of methods. So I personally feel we need to understand our students, create a safe learning environment. We need to think about cultural diversity and gender equality. We need to make techno-based teaching methods, co-curricular activities, work-life balance, mentorship, and mindfulness of medicines. And this is where I think you will find AI has to fit into all this. My sixth standard granddaughter came to me and she told me that she has a class of ethics in AI. And it is good to have AI literacy from the school days where they understand that AI is there, but we have to use it ethically. And I had to explain her what is AI and what is AI ethics. So I think this is very interesting. This is from a curriculum where school she used to do, and this was a class she was there. So we are advancing rapidly. Technology and data analytics are the game changers. So we need to upskill and network and communication. So are we ready to teach generation beta, which is going to come in 2025? This is a question I want to ask you. So I think all of us should really see that it will not replace surgeons, but will augment their performance. So I would like to end by saying that embrace technology while staying humane. And this is something which the last I would like to say. So learn new, embrace it, understand its pros and cons, but try to remain human. This is a message I would like to end with. So thank you and have a great time.
Thank you so much, Professor Supe. Dr. Nandi, would you like to say something now? You're muted, sir.
I had no idea what AI was all about. I think this is one of the best lectures I've ever heard, not only on AI, but on anything else. It's, to me, a person who knew nothing about it has learned a lot. And I hope that it has been recorded so that I can pass it on to other people. It is
Yes, it is.
fantastically good. Very good. Avinash, I'm proud to know you.
Thank you, sir.
Dr. Avinash, do you mind turning your camera on?
Oh, sure, I'll do it.
So, Dr. Sethuraman, your comment, please.
Yeah, this is what was presented by Dr. Professor Avinash. This current
Call me
rage in
Avinash,
USA
it's okay.
going in primary schools. Educational psychologists say these kids are excessively dependent on AI for all solutions. So then the basic scaffolding and learning is gone, just like the skills of math. they use calculator even to add 2 plus 3. So then the brains don't develop at all. So without the machine, they are totally helpless. I bought something for $1.90 and I paid $2, and that person didn't give me 10 cents until the calculator told her to please return 10 cents. I said, give me 10 cents. She is looking at me, what, you are a magician or what? So, no, that is the state of affairs. So it concerns the teachers. They are passing a rule now that until they go to middle school, that is, they'll be 13. Until the age of 13, no access to AI tools in classroom. And they tell the parents not to give, and they have to learn math and science and everything the hard way, so that the brain gets hardwired.
Sure.
So this is precisely what United Nations has pointed out this year. International Day of Education, I was telling in the beginning, is 24th of January 2025. The theme this year is preserving human agency and human willpower in the era of AI-based automation.
Sure.
So automation is good, but it's not that we hand over everything to machines and we become slaves.
Sure.
As Prof. Avinash pointed out, we should be the masters and use them as tools to augment our capacity. That it can do. I created a 11-page comprehensive workshop plan, including pre-test, post-test questions, the handout, and the whole works, PowerPoint slides, in a matter of about 2 hours. Normally, what would have taken for me about 1 week of preparation.
Yeah.
Using Microsoft Copilot yesterday.
Yeah.
So that is the power. But I had the idea of what I want to do, and I didn't tell Copilot, please give me the whole thing. And I used it as a tool rather than depend on it totally. So corrected all the errors and got redrafted, etc. So that is precisely the India has to go that way to make sure that the primary brain development till the age of 14 is not compromised by these tools. Thank
True,
you.
sir. Very true. Very true, sir.
Puneet, muted.
Yeah, I think Avinash, wonderful as usual. Professor Nandi put it very succinctly. I had the pleasure of being with him at Rishikesh a couple of weeks back, and then we drove back. And 6 hours, his natural intelligence was no match for my natural stupidity. So I think he's demonstrated the entire gamut of uses. Really loved, especially the analytics bit for surgery. I think is extremely crucial as we are increasing the number of students per teacher. So I'd seen one presentation in IHPBA where they actually had a tele-mentoring session, and the with a filter put by the AI. So I think those are fantastic tools, and all the other ones you mentioned. I think you showed the entire spectrum. Really, so little to actually discuss. But Pata, do you have anything to add before I call on people? That there weren't any questions.
If that Nandi was very stingy in his appreciation, if he gives a certificate that is the best lecture he's ever heard, there can't be a better thing than that. That's what I very personally feel. I mean, actually, I think even ChatGPT and DeepSeek put together cannot put up a lecture like this. If you ask it about AI in medical education, I saw. A while ago, when I was Dr. Nandi's chambers, like a child, he was smiling at what ChatGPT has to say about him, about Dr. Nandi. If you ask ChatGPT, can you say something about Dr. Nandi? Huge thing will come out. I mean, he didn't believe that the internet knows so much about him. I mean that's pretty interesting. This is a very, very complete, comprehensive lecture, and there's so many things. I think all of us have learned, so many new things from today's lecture. And as Puneet rightly said, there's so many stalwarts, and and the greatest thing is, of course, Dr. Supe, who's been a very conventional teacher of the yesteryears, is caught up with the technology. I mean that which many couldn't do. I mean that's a great thing, and I'm sure he'll be forging ahead with whatever is going to come in years to come. There are many giants here. I think they should be speaking. Puneet,
Actually, he's been
starting
very
with the
hands-on.
Vivek,
He's been
Vivek
very
has his
hands-on,
hand
and
up.
he's been very hands-on and current with everything. Actually, he's been one of the most, as dean, he was one of the most reachable. Anybody could just walk into his room. So I think he's been a fantastic role model as a teacher. So I think the CBME curriculum was sort of chaired by him. The whole change in that was chaired by him. He's always been helped with that. I'm just tempted to ask Avinash, how much did you use AI for the lecture itself? Since Pata said that, I'm just tempted to ask
Sure.
that.
I told you I very clearly disclosed. I have not used slides to make this, but I'm sure I used for outlining. I must tell you this. And as I said, recent tool which I'm using Perplexity. And as I said, it's an app aggregator. And this is something which is becoming more and more. As I said, people are getting Nova and Perplexity. And see, I think what I've been used for now, many talks which you get, if you get sometimes an odd talk, then I think it's better to ask them, get an outline. They suggest you some resources, but all the time they're not good. So you have to do your own research also. So you have to mix it. I personally feel, as Seturaman said it directly, what we said, you ask co-pilot or somebody, but then you need to trust and verify everything. You don't just put blindly cut and paste and put it. I think that's the lesson I would like to give to everyone.
Now, if I may ask you, sir, where did you learn all this from? Have you attended
Sure.
some course by Udemy
It's a
or,
good question.
because,
Yes.
but going through,
No, I did all attended online courses about 2 years ago. So when this came, I had there are online courses. The best part of online courses is that you can do at your own time. Whenever
Mhm.
you have 10 minutes free or 15 minutes free, you're traveling and you are not doing much, you are seeing only, instead of that, I attended these kind of courses. They are by Udemy, there's a doctor entrepreneurs kind of things. Now, though, there are people who have done degrees from IIT on this. But the small courses of even 4, 5 hours is okay, I think so. What you need to learn is a prompt engineering. Once you understand prompt engineering, then it's a question of just trying to use and learn.
And how many of these do you subscribe by paying money? Because we
Oh,
aren't very
I, I,
sure.
I, I, I use most of the time, I use free versions. I only subscribe one version, that is Perplexity. And that is, I recently purchased it. I think that's all, nothing much.
Yeah. No, Vivek.
Nobody's got his hands up,
See,
no?
Patta, I am a full-timer, Pakka full-timer. I cannot afford that so costly 2000 rupees per month and all. I cannot do that.
Glad to see you, Dr. Supe. Long time. This is Vivek
Yeah,
Chhabra.
yeah, yeah, yeah. Hi, Vivek.
Hi. Yeah, just my background that I was in Bombay, did my DNB in medicine, and then was in touch with Dr. Supe on and off.
Yes.
Currently in the UK as an emergency medicine consultant in
Hmm.
NHS.
Hmm.
And of course, I was in between looking after the medical preparedness of entire India through National Disaster Management Authority, Prime Minister Office.
Okay.
So now I will be just giving some bullet points.
Hmm.
Of course, amazing presentation, a lot of learning, a lot of new things for me as well. And of course, some fears as well from a different aspect. And some experience of myself with the kind of immersive way I had a chance 2 years back for the emergency medicine case presentations, which was absolutely the most beautiful experience I have ever had, and I could relate to that when you were showing some of the slides with the people having the the goggles wearing in your presentation. And so like I attended a case of GI bleed in that kind of thing, and it was absolutely very absorbing, very much learning. And I would say that I will beg to differ given that experience, especially in that kind of particular situation with you, that in that situation, I did not feel I was dependent. I was refreshing, relearning, and learning more than what I don't know, and learning the right thing to be done first, then the other one, like the right sequence of managing an emergency, which I'm aware of. I've learned so many times, but I learned much more further on the top besides the refreshment of the knowledge. So it's very good for people who become senior clinicians at our age when we need to relearn our own subjects because things change, guidelines change, and our practices can get rusted at times as well when we are not doing the similar kind of situation or handling the same clinical situation on day-to-day basis. So that's one thing I would like to add as compliment on to the slide. Of course, you have come from a different aspect, but I'm saying from a different aspect here, as you may be understanding from that part of emergency medicine, the simulation things. Other thing which I was wanting to say is that I find that your presentation was very comprehensive. It is, of course, understandable at the very mature level of the audience which we have here, because we come from that generation. We used to read a lot and lot and lot and lot, and we can absorb it. Having said that, I also had an opportunity when I came to UK first time. I gave the PLAB exam, and I said, "Wow, this is how it should be. Why the exams in India are so tough? Can't they make it that simple and straightforward and kind of thing? Because uh, judge the clinician on a kind of a particular level, and if one wants to go further or can go further, can go, but not everybody can." And I think that is what I'm trying to say. That your presentation, if needs in that way, kind of made more simplified so that it can be absorbed by the younger generation or people who have got what I should say. We all are wired differently, and there are a group of clinicians who are wired in a very different manner, that they will find it overwhelming, but at the same time they are very creative if they are given in that kind of a different format, like autistic colleagues. So that's what I'm trying to say, and that is an area which we have to also absorb into AI, so that the people who have higher spectrum or moderate spectrum of autism, and there are many clinicians, especially from the surgical field, we suspect at the moment, we don't have many studies as far as I know so far, but you will may know better, then that we can utilize this tool in a much better way and kind of design it in that manner for that particular very highly creative uh, experts we have, especially as I when I hear that surgical specialties and emergency medicine people, the majority clinicians are more autistic than other specialities. This is something coming in the UK, as from the research it's coming, because of the some kind of abnormal behaviors they
Sir,
also
can you
show, which are on the
conclude?
wrong
Because
side.
there's so many other
Sure.
people to comment. Yeah.
Yes, I'm finishing now. So, but I thought this was a very important point to touch because it's a untouched area, but it's a coming up very much in the Western field, and we must not be forgetting that, because it's something which is very much
Sure.
underdiagnosed in our country. That's why I
Sure.
came from.
Vivek.
And with that, I would like to conclude, and of course, would like to stay in touch with you. And if you can form a national council of something like on AI, which you can lead, or with the team you can lead, I think that is the need of the hour, because otherwise we will be working in silos separately. But I think we need a national
Sure.
level
Vivek.
council, something like that.
Thank you. Thank you, Vivek. Two only quick answers.
Yes.
One is yours. You said emergency and all. Working for AI in a non-technical skills is a complete new area. Tomorrow, I'm going to speak in AIMS Delhi on the same topic. But what is more important here is you talk about autistic. Amir Khan had a film called Tare Hai Zameen Par. So it took so much of time to find and have a pattern recognition. What was the change? Now, this all can be done very quickly with AI, and then you can give a remedial therapy quickly. Now, this is where the education can change.
Yeah, Professor Surendra Mathur, would you like to say something, sir?
Yeah. So
Yes,
Avinash,
Mathu sir.
excellent lecture. Okay. Very well covered every aspect of the AI. So for the information of all the audience here, Avinash has got a child's brain. That's why he can learn even today anything he wants. Okay. It's a very active and fertile brain he has got. So means I can't match. Okay, let me accept it. Now, only comment I will make that AI can help. We know that amongst the students, they are slow learner and a fast learner. So, in the class traditional way, when we are teaching, we can't differentiate, and the slow learner suffers. So, perhaps the AI can help those type of students differentiate and help them in training and learning. I don't know what Avinash says about.
No, you're very right, sir. There is one college called Iraz Medical College. So they have created a software in Lucknow where if the class of 250, they can find out last 10% or 15% of students who are not able to do skills effectively. Now they can find out, and then they will give them extra classes. But whether to do this for a cognitive kind of a content, I think there's a lot of research Western side, but not much in India side. So we need to explore these areas, sir. We are process of only understanding this AI. I always feel any processes go through 4 phases: awareness, training, practice, and then quality improvement. So we are in a phase of awareness and training. The next phase will come when we'll start practicing day to day, and then will come quality and standardization. So I think it's a over period of time. Next 5 years are important years when we'll see practice and quality and standardization will come. Till that time, we are just exploring it at this stage. Thank you. Thank you for that comment.
Can I-
Ravishankar, you have your hand up?
Sorry, can you hear me? Yeah, thank you, dear. Beautiful talk, really wonderful, and it's sort of very timely for me because I'm way behind the 8 ball here and trying to learn more about how to use AI in my daily activities. One of the things that I put a link in the chat was the recent Nature review that looked at a bunch of publications that had not reported use of AI and discovered very telltale signs of AI use in them. So not everybody who's using AI for either managing citations or even texts in the introduction or discussion is actually approaching is actually disclosing it. So that's one major issue. The other thing that I have discovered using an AI tool that my company is sort of working on is you can put very complex papers into the tool and have the tool analyze the paper and spit out summaries in layman's terms, or explain, summarize the paper in bullet points, etc. And I've gone back and looked at it because this particular tool actually gives you from what page of the article it pulled up that particular conclusion. And you can go back and check and see if that is indeed correct. And it does a very good job. So I really sort of am enjoying that part of this tool that we're building internally. And there are so many other things using available software for people like me. I work for a pharmaceutical company, and so we have proprietary information. So we don't use, say, ChatGPT or anything else like that. The other point that I would like to make and have people comment is basically the use of these engines like DeepSeek, etc., and the breach of privacy to the individual, not anything else, because they apparently do track keystrokes. They track a whole bunch of things which could be pretty difficult, particularly since some of these are not owned by friendly countries. So with that, I'll go on mute and
thank you, Ravishankar. I think Vidya, I have one request. Many people have put a lot of resources. I would like to have an access to that. I think this is something which you should also share with everyone in the chat box. And I think
that will be done, sir. There's not a problem.
Thank you. So what I wanted to answer to Dr. Ravishankar is, see, currently we are using, especially talking about precision medicine. No, what my concern is, we are getting a lot of people using AI for precision medicine, especially if you see cancer thing. People do IHC, they send report to the Sloan Kettering, and they get what is the best treatment for this patient. But they are all using data which is a westernized data. And I'm not sure whether that data is giving my patients a right choice. Everybody should be aware. I'm just getting it from Sloan Kettering or Anderson. That doesn't mean it is the right kind of a diagnosis for me. We need to create our own repositories. We need to create our own databases, train it, and then use that data how our patients are doing. Something like simple like carcinoma gallbladder doesn't behave equally in all levels. I mean, sometimes it is more aggressive, sometimes it is not aggressive. So how are you going to accept that? So we need to have Indian databases to give our answers to precision medicine. And same thing is in education. So there's a long way to go. We are trying to just, as I said, explore it. Yes, Tilaka.
Hi, sir.
Hi.
Evening. Hi, everybody. Sir, that was amazing. Actually, AI can do so many things. Like your talk was absolutely amazing. I'm very stunned, and I want to congratulate you for this amazing talk. I just wanted to ask your opinion about one thing. Like you rightly said, we're not practicing it largely. But what we're trying to do because of the enormous gap between trained faculty in skilling and in simulation and in the large number of students, we're trying to do two things with the help of technology experts. One is generation of content so that independent of faculty and at the discretion of learners at the time that they want, learners can actually start learning skills. That's one. The second thing is because every skill we'll be able to quantify only through an assessment. And if one teacher has to do assessment for 250 students for 50 different skills, that's going to take a large amount of time and energy. So we're just trying to work out on a methodology where we can use machine learning, we can videotape, use machine learning, and AI can analyze the skills. The faculty or the facilitator can only help in debriefing or in giving feedback. So we're trying to work something like that.
That's
I just want to
exactly
know
where AI has
your
to work.
opinion. Sir?
That's exactly where AI is of useful. Especially we have 250 students. The whole student's record, like in simulation, gets recorded, analyzed, and you get a kind of a chart. What are the difference? See, previously there used to be a home pre-residency program. Now you have a skill-based residency. For everybody's information, Tilaka is managing the skill lab at Apollo Hospital, Chennai. But when you are having, say, many students, you have, say, 70 DNB students, and they are doing, say, basic surgical skills, suturing. You collect all that data and put into the deep learning. You will come to know who is doing rightly and what mistakes they are doing. Is there a pattern and what is the individualized deviation? So then you can concentrate only on those rather than trying to retrain or teach them a formal lecture. So the education path is going to completely change in this direction.
Thank you, sir. But I'm a little concerned that the importance of that facilitator or a faculty would reduce if once we automate all of these things. So equally excited I am to go down the path of creating along with
No,
everybody.
don't worry
Also
so much.
equally concerned and worried.
See, I have to tell you
I'm
very
not sure about
clearly.
that at all. No, yeah. I'm not sure
No,
about
don't
that
get.
at all. I don't know. Even in robotic surgery, everybody's worried. Oh my
Ah,
God, the robot is going to take over. It's just robot assistance, and I think it's been a huge boon. There's no turning back from there. There are some issues, but I think there's no turning back from AI as well.
very rightly said, Puneet. See, when pilots got this or Tesla card came, I think people are still afraid to sit in a plane where the pilot is not there. So what we really need is a pilot with AI trained. Same thing is going to happen. We need a teacher who is AI trained. He can do it better for you, and he can reduce his load, and he can give you much more personalized kind of an attention. Now, that is the reason why, Tilaka, I feel this mission of mine to do AI literacy across various medical college. I know I'm only alone, but now I have a lot of, I feel people will come, will help me to do this AI literacy across medical colleges. It will help
Absolutely,
equally. It
absolutely,
will help it.
absolutely,
You please
absolutely.
conduct a train the trainer session, sir. We'll all come and then we'll join you.
Actually,
Absolutely.
while on that, we have actually, is Kamal
Thank
there?
you.
He's there as Amrita AI. So I think Kamal, if you can unmask you're the face of Amrita AI anyway. So he's labeled as Amrita AI. Kamal is
Oh,
the
wow.
dean of our School of Artificial Intelligence at the Amrita Vishwa Vidya
Oh, my
Peetham.
God.
And yeah, he's Dean of Digital Technologies as well. He's done a course for all of us, the AI for Doctors, which was free, of course, initially for the Amrita at Cochin and here at Faridabad. But he's been developing patient-centric technologies via mobile labs. We're working on quite a few stuff. He's also the director of the Amrita. Would you like to e-learning research lab? Would you like to tell us, Kamal, what all initiatives you feel on the tech side? Because we've heard the medical side of things. I think we're all scared of the tech side. So could you enlighten us about those?
Sure. Thank you, Dr. Puneet, for this warm introduction. And again, Dr. Avinash, congratulations on a wonderful talk. And yeah, one of the things I would like to mention, especially since we were talking about data in India, we have two major hospitals, one in Faridabad, and one in Kochi that we've had for over 25 years. And the good thing about our Kochi hospital, as per the direction of our Chancellor Amma, was that from the very beginning, we have kept the data properly. I mean, not fully structured, but reasonably well. So we do have a huge data and, Indian data. Yeah, obviously, Kochi, Indian data. Yeah. And so, but we are still working on structuring it. I think that's going to be a huge thing. So if there are any big major projects that you would all like to collaborate on, please do let Dr. Puneet or me know, and we will find a way to work together. Regarding, we are doing numerous projects here in Delhi, Faridabad. I'll just briefly, share my screen, if you let me. Just for a minute. And can you see my screen?
Yes, it's coming on. I mean, it started.
Yeah. So, I hope you can see my screen, Puneet.
It hasn't come yet, it's.
Oh,
Yeah.
okay.
Yeah.
Okay. I just wanted to show you that, as you were saying, sir, we have a wide variety of AI projects that we are doing, in Amrita across various campuses, and, derma, scheduling,
Oh, wow.
now chatbots, mental health. And we are calling all of them as agents, AI agents, because when you specialize the AI knowledge in a very particular specialized way, the knowledge of that agent becomes very specialized, and it can be of great benefit. I'll give you one very, very quick example here, like the hospital appointment system, and I'll just run it. And this is voice based. So,
अमृता हॉस्पिटल फरीदाबाद में आपका स्वागत है। मैं किस चिकित्सीय समस्या में आपकी सहायता कर सकता हूँ?
मुझे 2-3 दिनों से हाथ में खुजली हो रही है।
जी, ठीक है। आपको कितने दिनों से खुजली हो रही है और क्या और कोई लक्षण है? क्या खुजली बहुत ज्यादा है? और क्या आपको कोई चकत्ते या दाने भी दिख रहे हैं?
नहीं, सिर्फ लालपन है, मुझे डॉक्टर से मिलना है।
ठीक है। आपका नाम और फोन नंबर क्या है? और आप किस दिन और किस समय पर अपॉइंटमेंट लेना चाहेंगे? डर्मेटोलॉजी विभाग के डॉक्टर मोलिशा भंडारी से आपकी मुलाकात करवा दी जाएगी।
ठीक है, मेरा नाम कमल है, मेरा फोन नंबर है 34567 34567, और मैं कल 3 बजे अपॉइंटमेंट चाहता हूँ।
जी कमल जी, आपका फोन नंबर तो साफ नहीं सुनाई दिया। क्या आप उसे फिर से बता सकते हैं? और कल के लिए आप किस समय पर अपॉइंटमेंट चाहते हैं?
मेरा फोन नंबर है 34567 34567, कल 3 बजे।
ठीक है कमल जी, तो आपका नाम कमल है, आपका फोन नंबर 34567 है, और आप कल 3 बजे डॉक्टर मोलिशा भंडारी से मिलना चाहते हैं, जो डर्मेटोलॉजी विभाग में है। क्या यह जानकारी सही है?
बिल्कुल। ठीक है।
I think this is like Mira, which was made in AIG, I think it's this. I think I'm so happy that we are getting health communicators in India, which are being developed, which can really help us. And this was I was talking about agent-based kind of simulation, And these are coming up in a avatar based, agent based. Now these are new things which are coming, which are picking our in our place. Though these could be little elaborate, and sometimes you get irritated with a bank, those numbers you dial this and dial that. But I think over a period of time, this will be more close to what you really want, and it can make a lot of changes which can really help in our system. I think this is something we should look forward. Very nice.
Right. So,
Thank you. Thank you so much for sharing. I'm really happy to see this.
yeah, because this brings in the voice-based thing. Otherwise, we are all afraid of technology, many of us, and cannot access technology. So the new wave in the next few years is going to be everything will be voice-based. So you can directly communicate and talk to the app, so
Yeah, yeah.
that even the rural people, the remote people, and the illiterate people can directly get the information from the doctors.
Sure. When I was a director of KEM, I tried to, we had a connection with Google. And so I had a lot of discussion about how we can bring text to audio to text kind of a thing in a EMR. And they helped us also. But our doctors, unfortunately, did not accept it so easily that time. Maybe now they will accept it.
Yeah, so this is the reverse. Actually, we're working on models where we are taking we are talking to so it was funny that we use the machine to get more personal. So I was just beta testing with Kamal. While I'm interviewing a patient, normally I go to the screen on the computer screen and I'm typing. But now with this, I put the phone down with the mic on, and the AI agent is actually getting the data out and then sending it to me as a history.
Yeah,
So
it happens.
and actually I had eye contact with the patient. The patient was thrilled. So I forgot to tell Kamal this. The patients were actually thrilled that I was actually spending time with them. So the
Yeah.
other thing in education, I think, is that some of our there is a lot of English bias that we have, the Western bias. The smarter the kids are in English, I think the better they do in our medical education system. Whereas this has the potential to take it to with the Marathi or the Malayalam or the Hindi tool, because in AIMS Rishikesh we found a lot of the toppers are not very fluent in English. So I think that it takes care of that bit and yet has the resources available to everybody. So I think that's another advantage, that you can personalize it to your language
I know,
kind of
but
a thing.
Puneet, I've used this in Marathi and Hindi tremendously to.
Right.
It does not generate the kind of words today we want. Sometimes I feel I'm from a higher Marathi, so I sometimes are not very happy with what they create. So I think it is still in a process, but over a period of time, I'm sure they'll do it.
Yeah, it's bilingual.
Working
Yeah.
language, they do it. The
Yeah.
little linguistic and little high level, it doesn't produce yet.
About
I'm little,
समाचार में हिंदी सुनिए. Yeah.
Puneet, I'm a little worried that the chatbot, that lady, couldn't identify that there are too many digits in the telephone number. I think she'll say, no, there are too many digits, that's a wrong number.
No,
No, 10 digit, 10 digit.
he told 10. 3, 4, 5, 6, 7, 3, 4, 5, 6, 7. He told 10.
Oh, right. Oh, that's great,
So,
Vidya.
so if none of you have objection, can I ask for that for you to run a few seconds on your PAC thing? I mean, I'm an anesthetist.
Oh, sure.
If
I would
none,
love to
if none of you
listen.
have an objection, like
Yeah, sure.
time.
Meanwhile, I'll just while your screen is coming on, I think the Pata uses Kahoot a lot for quizzes and all that,
Yeah.
and they're extremely popular. So I think there's a whole way of using a lot of these things. So I think he's pushed for the use of Kahoot in class, and I found that very few takers for that, because I think we also have to work a little more. It's easy for us to go back to the same PowerPoints which we've been doing for a lot of time. So I think it's time that we need to.
Puneet, I was in Belgaum 2 weeks ago, and they had taken a subscription of Kahoot, and their vice chancellor was screaming to me saying that they are not using it well, and they are not using. So I think, see, question is, even if you use Kahoot, you have to understand the hard work which Patta does beyond that Kahoot, behind that Kahoot. So it's Kahoot is only a method. Actually, you need a lot of hard work done by teacher also. It has a human component which is equally good.
True,
Yes.
true.
So, Puneet, can you put in my request? And
it's not only.
meanwhile,
Can I-
Dr. Avinash, Tilaka introduced us to Mentimeter during her session on interprofessional training. And so now Radhakrishna is going to use that in our next meeting.
No. In our conferences, educational conferences, Mentimeter is very commonly used. So when we take a conduct sessions in a large group, when there are 200 or 400 people and we are conducting a talk, we use Mentimeter for developing themes. It works very well.
I think another thing we chatted about, which is also a potential, is the use of the Myers-Briggs type indicator for making teams and all that. I think in medicine, like you said, you found it very useful, isn't it? So for
Yeah,
Vidya, there's another topic.
No, Myers-Briggs, I think I was introduced in 2002 in USA. And I remember after that 20 years when I became dean, it was very useful because I think this is something which people, I think you can find out some good psychologists for that. He would take it better
Yes,
rather than me.
yes. Sorry,
Uh,
Vidya, go ahead.
no, I just wanted the TSC demo to run.
So,
So
Go ahead.
other thing was Venkatesh Natarajan, you had a lot of questions on the chat box. Would you like to verbalize any of them?
Yes, ma'am. It was an excellent talk. The compilation was extremely good. Sir has actually given a roadmap for how to go about AI and using AI tools. And I think this talk should be on, as early as possible, we need to put it in the YouTube channel because it will be extremely useful for everybody to pass on this information. There are a couple of questions. The first question, which I would like to know about it is what are the downsides of using AI in education? That is something which I would like to know from the professor.
see, probably previously we used to have a great respect for a teacher that might, as he, Tilaka was worried, we have to see those teachers who have using the same PowerPoint for again and again for many years, or they don't come prepared, students will not respect them. Now we have to learn AI and find out a complexity beyond what the Google or AI gives. And those clinical situations, if I show my competence at that level, that is our challenge. And secondly, AI can have tremendous biases. AI doesn't give you the truthful answer all the time. So we have, like, for example, 30 years experience, and it will give you what is standard in a guideline, but it may not suit to you. So we need to, so don't use AI for patient care at present. It is not really good. Many people would say people were using for patient care. I don't think patient care, it is ready. You can try it out, Puneet, but it is not ready for this. For communication, content generation, it is okay. It has its own biases, it has its own errors. So I think we need a phase where we need to verify everything. And that's what I think Seturaman's survey was perfect, actually. It created so many mistakes and people have to get corrected on this.
So
Venkatesh,
my
you had
concern is, sorry, sir. Can I have one
you
more
had an
question?
interesting question of whether you would dare to get treated by a chap who did MBBS with AI.
I'm not ready yet. I'm not ready yet. I don't.
Will we reach there, sir? Will we reach there to that point where
5 years.
doc
We have to see next 5 years how we are going to walk this path. I
So
think that.
Venkatesh, you may not have a choice. Where everybody is that way. So,
Yeah, that is true, sir. But the concern is medicine is intensely, the doctor-patient relationship has already been reduced to a consumer-provider relationship in most countries. And medical practice is a deductive reasoning. And if you're not going to flex the muscle with the basic tools, your brain and your ability to absorb information, see, observe, feel, and learning the heuristics and the analytical part of it, only when somebody reaches to that point, he can actually use a tool. And that is my concern because the overemphasis on AI at a much younger age would probably push the traditional time-tested learning methods. That's my concern.
So I have actually written 2, 3 perspective articles. I'm sure one is in Right and two were published into Springer Nature on will AI replace physicians, and which areas it will replace, how it will replace, where there will be an impact, where there will not be impact. This they were published this year, and there's one more article which got accepted, which will get published in next few months. So I think a lot of literature is coming on where AI will be useful and where it will not impact, and what is the impact, which is moderate impact or large impact. So I think it's time will only tell you how much it will really refine over a period of time.
The other concern is, please indulge me with one last question. The impact of environment, the degree of power consumption that we are talking in terms of using AI in practically every field, is it going to be sustainable in the long term?
Puneet, We had a workshop, we had a session here last year, no? I really don't know this answer, to be very frank. I mean, I have never explored on this, but I'm sure there is a computational cost as well as the power cost. Both are to be part of this because, I mean, I think mobile network has grown so much, but it has its own lithium batteries and it has caused its own problems. So I think we need to think about this aspect of sustainability over a period of time. I don't know. What
So
are
I
your
think
thoughts?
I think what Venkatesh is talking about, there's one guy, I forget, one of the millennial surgeons actually told me about that name and I Googled him. So basically, this guy says that just the thank yous in all these chatbots, just saying thank you, being polite to the chatbot, uses up crores of money. So then I asked, Claude AI and ChatGPT, what is the actual impact on that? They said this is all built into the cost of that. And because that those polite responses actually helps the machine learning better because it knows what pleases what it's also teaching the machine
Uh,
also politeness, so
Puneet,
sometimes it's even more polite than us.
I think they taught me in my first course, they taught me how to please AI. You know, you write some praises for them. You really write that I want this in this particular kind of a tone, and they write it that way. And you say that I'm very happy that you wrote this way, but I would like to have in this. So you have to just learn the language, and they pleasingly do it. But I think he was talking about even the sustainability issues, you know,
Yeah.
which about power and all. I think those are, I think we have not explored them yet.
Yeah, I mean, I think that's here to stay. We can't. It's like saying washing machines are going to use power, so we should go back. I think there are some things which have, we can't turn the clock back. So we probably have to generate more power, by whatever means sustainable, hopefully. I think we are moving there. A lot of the electrical stuff, the hydrogen cells. I mean, every time we are scared that coal, I remember an ad about 40 years back in every petrol pump. It used to say, save fuel now or walk to your destination in 20 years. That was the estimated time of coal to run out. And we've kept finding CNG and alternate fuels and all. So sometimes I think we have to the problems, instead of harping on the problems, we need to look at the solutions. So I think
Uh,
if we look at
Absolutely.
go
You
ahead.
know, previously we used to use lights of 100 watt and all. Now we use it of 7 watts. So we have
Absolutely.
reduced the consumption of the electricity in our home so much, and we have equal amount of light. So I think we have to find these solutions.
So there has been a lot of talk about AI literacy. So Angeline had been typing a lot of messages in the chat box. So Angeline, would you like to speak about that? Angeline, you're there?
So till she comes up, and there are a lot of questions about
Oh,
how people.
Sanjay Bedi is here. He's doing a lot of work on AI literacy. Anyway, you ask, go ahead with
Am
this.
I audible,
Yes, I am
Vidya?
there.
Yes, yes,
Yes,
yes.
yes, yes.
I just want to talk about the free courses. I'm retired now. So since 1 year, I'm engaged with this AI stuff.
Angelina, you keep retiring every now and then.
No. This time final. Nobody can push me back into the workforce. Nobody can push or pull me back into the workforce. So that's it. So a lot of free courses are available, and especially AI in healthcare. You just have to go to Chat GPT and prompt. You'll get enough references, and you can take your free courses. And LinkedIn is a very good platform. There are very nice experts who sort of, break down everything in such beautiful graphics and give it to you. And they are also patient to connect with you and take you along in their journey. So my take now is only to talk about how can you grab all these free courses and the knowledge.
No, agreed. We have to keep our eyes open. That's all. Go on grabbing. I personally feel, and Puneet and me are the best in this world. We have been working like this
Never.
only.
You can go a little distance, then it says you get the other version, paid version. It'll entice
No,
you a
no.
little bit, then you're in trouble.
Yeah. No, it's costly also. No, we can't afford the Western rate so much. And I think,
So you can actually, batch up for the Amrita. We have a developers thing, and I mean, there's no, unlike Netflix and all that, where there's a limit to the number of subscribers. We can consortiumize. So if you have a user group, you can buy it as a group as well. So you can cut costs the way they.
students versions
Yeah,
are
yeah.
very cheap. And as a teachers version, they're easily available for teachers also. They're cheaper. You know, you don't have to spend so much on this.
A lot of it is kept cheap because we are training the AI models as well,
I
the agents as
asked
well.
one tech fellow what he said me give answers. He said most of these, like say data squirrel, it will give you 4 data analysis free. So he says, I have 10 emails, Puneet Dhar 1 at Gmail, Puneet Dhar 2 at Gmail. So I have 40 things which I can do. And that's the way they do it. Most of the techs do it. But as you said, the institutions, if they buy a version, which is a educational version, then many of these are cheaper. Soon you will find our libraries will have these versions. I'm sure like we have now MyLoft or up to date and all, we'll have somebody will have institutional subscription for Perplexity or Nova and all. And this is going to come. This is in the pipeline, you know.
So there seems to be a lot of concern in the, I can see, subliminally, the main worry is why are the students getting a shortcut when we had to go through all those index medicals? I think that's ridiculous. I think the society has to move forward. We can't, cull all those educational tools like the way we did. So I think we have to move on. And I think it's even if they use it for literature tools, Dr. Vasumati, who's just switched something on, is fantastic at the resource, how to look at resources. My son had done a course with her. So I think
Vasumati, I have a request to Vasumati. She should start a course on AI literature search. It's time she should work on this.
I'm working on it.
Yeah.
Yeah, but Puneet, there are so many schools which have banned use of ChatGPT and DeepSeek. You know that you can't use it.
Stupid. It's stupid. Like they banned mobile phones on campus, and then the moment COVID hit, everybody was forced to be. Every child was handed a smartphone. I think Dr. Sanjay maybe has unmuted. You wanted to say something, Dr. Sanjay?
Yes. Sorry, I cannot start my camera because I'm in Amritsar and there is a blackout and something is happening up there.
Oh.
So yeah, Jammu's under threat. Yes.
I'm in Amritsar, so last night also we had some activity. So basically, I see. I am doing. A lot of students are medical teachers and general doctors are also teaching, and quite often I see that there is we have to start teaching them from the very basics. How to make, lot of us are still at the very basics, and which is a large population. They have to be taught. Second, there is a large number of possibility that Government of India has provided each one of us with 30 GB of data in our mobile phones in the form of an app. It's Umang app, in which all our data, including our patient records, can be put into it. And now we have a Abha ID with all of us. It is being made in all medical colleges. And gradually it will be moving into private sector also, which provides a 140 crore database possibility of patient records linked to our mobile phones. 30 GB data everyone.
Sanjay, it's a time now that Government of India, like many other things, should create one LLM for the students, and it should give free access to everyone. It's not very difficult now.
It's not very difficult. I also have it. So people were saying it's free. I have one connection, and I think whole of my family, many of our teachers, about 20 people use the same ID. So it shouldn't be a problem. My son who is abroad, he also used the same ID, and my daughter in US, she also uses the same ID, and it is no problem. It keeps on only with that we have to share each other's searches. It is visible who is searching what, but it's okay. And
that's
yes,
a privacy issue.
Yes, yes.
Okay.
Then there is one more thing which is a new thing which has come, that is quantum computing. Quantum computing is something which is going to convert India into the hospital for the planet. it's the something you can say that a few atoms they change in a gene and it becomes a tumor, and then it spreads into the tissue, into the body, and that's so. If we look at the macroscopic level, one person like say Mahatma Gandhi or a Hitler, he changes and he involves the whole country. There is a correlation what is happening under the microscope and the macroscope. I mean, the same energies are flowing.
Vidya, you have one topic for the next marvelous medicine.
Qubits. Yeah, qubits.
Yeah,
Yes.
Dr.
I mean,
Vasumati wanted to speak. Yeah.
yes.
Hi, good evening, and Dr. Supe, as always, it was a wonderful session. So, since there was the comment about introducing AI in searching and other related comments, Dr. Dhar, thank you for your comment as well. I just wanted to share a couple of things that I came across recently. For example, mesh in the Medline, it has been gone into automated indexing for the last couple of years. And librarians world over have shared in our mailing list some hilarious stories like one study was on cauliflower shaped warts, and that got indexed with brassica, that's the cauliflower family. This kind of thing happens with machine-based indexing. But unless people know that such things are possible, they're going to rely just because AI has generated literature. So that's why, I mean, I keep saying it's like knowing anatomy, physiology before you get into medicine. And as Dr. Bedi said, a lot of basics have to be taught first. And again, with searching the literature, it is the GIGO concept that works. If we don't put in the right queries, whether it's in PubMed or in AI, we are not going to get the best. And that kind of baseline training is still essential. So those are feelings that I've observed. And at a recent conference I attended, somebody said that you should Google this term. I just noted it down 1 second. Yeah, vegetative electron microscopy. So he asked all of us to Google it. We got that page. So apparently that was a fake term that was doing the rounds. And how it came was, in the two columns that you have for journal articles, the vegetative came from the 10th row in column 1 and the electron microscopy 10th row in column 2. That became one term. This was AI's interpretation.
No,
so
but
unless people know all this, know what is right and wrong.
Vasumati,
So
the
stress is,
whole crux
yeah.
is about prompt writing. And everybody should
Exactly.
undergo course on prompt engineering, what they call. In fact, I think all of us should train our people on prompt writing. How do you write a prompt properly? And if you write prompt properly, then you will not get all these kinds of things,
Precisely, sir. That's what
exactly.
I'm
So
trying to say, like how.
when I'm talking about AI literacy, I want people to understand this and learn about this prompt writing. And then they should be also use this. I always call human intelligence with artificial intelligence is augmented intelligence. Augmented intelligence.
Very, very
In
well
fact,
put.
the
I had
tool.
the same problem. I had the same problem when I used polyps because the organisms came up. So I actually used that to its advantage by showing the MBBS students that I realized 99% of them didn't know where the term polyp came from. So I tried to tell them if you use etymology, it's so much more interesting. So I actually showed them, ChatGPT is going to show you this. So I think the way out is what Wikipedia does, disambiguation. It does that if there's the term which is got multiple fields, it disambiguates and tells you which of these fields you want. So like Avinash said, we'll have to sort of train the machine. If Kamal is there, I think that's one important thing from our medical side. You need to look at that, the disambiguation of confusing
It's
similar
called as hallucinations. It's called as
hallucinations.
AI
Exactly.
hallucinations. So we
Hallucinations,
need to cut down these biases and hallucinations. And that's where more and more machine learning happen. It will cut down your biases and hallucinations. It's a term which is used, hallucinations.
And prompt engineering is really an extension of what was first GIGO. You put in garbage, you get bad thing. When it's when you search databases like PubMed, if you don't use the right and or, you're in a mess. And that is what has to translate into normal language in AI. So unless you don't know that base, you're making a mess. So that's the kind of thing I'm saying.
Puneet,
Base learning has to.
I must tell you, there are some prompt engineers in US who are getting pay of almost 1 crore. And one more thing I want to tell you, there is one site called as Python, which will write a proper prompt for you. Python is a prompt writing kind of an app.
The other thing which you said, the branching thing, I was shown by one of the millennials actually. So this is one important thing is, a lot of this prompt engineering we can learn from us. You're all saying how do we train the students, but I think this is one place where I've been learning from the kids also. So I think keep your eyes open from the reverse side.
Reverse teaching.
The flip classroom, quite literally.
Perfect. I think so. Okay.
So the sites and other information that was requested by people is there in the chat box. Of course, Dr. Avinash will give you the transcript of the chat box also. I'm not sure if I can reach it to everybody. So we'll just hold, please go through the chat box. Those of you who asked for the free resources, and also Dr. Sanjay Bedi has also put in a thing about how to learn to write prompts. So today, Dr. Avinash, nowadays post-COVID is not that common for us to have 100+ audience, but you have enough people who want to get literate. That much you can be rest assured. Whether we actually follow up and become literate is another story, but more than 100 people came to listen today to this topic, and obviously the fact that you were speaking probably drew in more people. So thank you one and all. It's been an extremely interactive session, and as usual, we have overshot time. And actually, Radhakrishna is supposed to be on some other meeting from 9:30, or 9 o'clock. I don't know, whatever. But so we'll meet again next week. And like you and Dr. Puneet said, we've got lots of ideas for future marvelous medicine sessions as well. We hope to see you all again soon. As of now, the next week, we are going to have a slightly hatke session. We're going to do a session on music therapy, where we are bringing together a musician. Of course, Dr. Sethuraman is going to moderate because he's published on that topic as well. So we're going to have musicians. We are going to have music therapists, doctors, and gynecologists, anesthetists, all kinds of people together for a panel discussion on something very different from what we discussed today. So hope to see you all next week.
Thank you. And it's a really honor for you today with all of you. Thank you so much.
Thank you, sir.